Roseola Infantum or sixth disease. Refer to the Pediatric Board Study Guide, 3rd edition, for the most recent updates in infectious diseases. This is a 9-month-old boy with rash all over the body for 1 day. He had fever for 3 days before the rash, associated with runny nose, congestion, and fussiness. On examination, he's alert, active. He has maculopapular rash all over the body. He is feeding well. What is the most likely diagnosis? Sixth disease, fifth disease or erythema infectiosum, scarlet fever, varicella, or herpes dermatitis? The correct answer, sixth disease or Roseola infantum. Roseola infantum or human herpes type 6 infection, that's why the name sixth disease. Clinical presentation fever for 3 to 4 days, can go longer than that. When there is no more fever, the child starts to have rash all over the body. The rash is maculopapular rash. Usually doesn't bother the child, just bothering the parents. The child may have respiratory symptom, runny nose, congestion, cervical lymphadenopathy, vomiting, and diarrhea. The most common scenario I see with cases of Roseola infantum, the child during the febrile illness prescribed antibiotic for possibility of ear infection or any other reason, and then they come with the rash and the fear of allergy to amoxicillin or to the antibiotic. But of course, this is not allergy to the antibiotic, this is just roseola. Other manifestations can be seen in cases of roseola: Berliner sign, which is puffiness of the eyelid, palpebral periorbital edema; Naga spots, which is erythematous papules on soft palate and uvula. Febrile seizure is a common association with cases of roseola because the fever usually very high. In extreme cases, you may see encephalitis, meningitis, or hepatitis. Management is mainly supportive as long as the child is having fever and in between fevers, looking fine, feeding, no respiratory distress, fever is less than 5 days. Provide only ibuprofen, pain control, ibuprofen, acetaminophen, no need to rush for starting antibiotic. This child will be able to go back to daycare once this rash appeared. This rash is not contagious. This is high yield. This is the end. Thank you.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple-choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.